So now again we are starting with a very important topic, that is necrotizing enterocolitis, NEC, right? So it is defined as wait, cool. So it is defined as acute intestinal necrosis of unknown etiology. Acute intestinal necrosis of unknown etiology, right? There is no known etiology for the development of necrotizing enterocolitis. So talking about some of the risk factors. Okay, the first thing that we have to know is prematurity. Prematurity, it is one of the most important risk factors for the development of NEC, and it is called the single greatest risk factor for NEC, right? If the mean gestational age is from 30 to 32 weeks, right? So there are development of 10% chances for the development of NEC, right? Another risk factor is aggressive use of formula feeding. Aggressive use of formula feed, right? I mean, based on the risk factor, you will see that this mother is not very caring, right? The baby is premature, she is not feeding the baby her own breast milk. Lack of breastfeeding, right? This mother is not feeding the baby properly, she is giving lots of formula feed, right? The fourth is fetal hypoxia. Fetal, she didn't even deliver the baby properly. And the fifth, the best one, there is maternal cocaine abuse, right? Cocaine abuse. So you are saying this is not a good this isn't really a good mother, right? So these are the risk factors for the development of necrotizing enterocolitis, right? Now the best part, the most important part, I'll be making a table. I'll try to make a table properly so that you can understand the different stages of NEC along with the general features, the features that will be seeing in the abdomen, the investigation and treatment, along with the investigative classification of NEC. Everything will be covered in just one proper table. So I'll try to write it as clearly as I can. So let's start. Fine. The first is stage, general features. So abdominal features, right? Investigation. Oh, wait. And treatment part. Fine. So this is going to be a long table, and once you are done with this table, you will be having a very good understanding of this overall disease, right? First stage, the first stage, it is called NEC suspect. Fine. The general features are, there is temperature disturbances, there is temperature disturbances, there is apnea, there is lethargy, right? What you will see in the abdominal features, there will be feed intolerance. Feed intolerance, the baby won't be feeding properly, right? What will you do in the investigation, right? We do the abdominal x-ray, x-ray abdomen, right? This is what we do. So it will appear out to be either normal, or there will be mild abdominal distension. That's it, right? And here we are writing the classification. The first is 1A, it is called occult blood in stool. You will find occult blood in stool. Occult blood in stool. This, sorry, wait. Come on. 1B, it is called fresh blood in stool. Yeah, fresh blood in stool. So these are the two investigative gradings of it. And how will you be treating the baby? The treatment part, we'll give the baby nil per oral, NPO. Fine. And we'll start IV fluids. We'll start IV antibiotics. Great. We'll be doing this for 48 to 72 hours. Okay. So this is the grade 1 or stage 1. Fine. The second stage is called it is called definite NAC, right? The general features will be similar to this one: temperature disturbances, apnea, lethargy. What will be the abdominal features? There will be absent bowel sound, right? There will be absent bowel sound, and there will be mild abdominal distension. Cool. In investigation part, we will be doing the abdominal X-ray again. Fine. And what are the things that we are going to see in this? In the abdominal X-ray, what we will be seeing, the two features that we are going to see. First is the pneumatosis intestinalis. What happens is that we will be seeing this. It is called the second A stage of it. It is called pneumatosis intestinalis. It is the air in the wall of intestine. Pneumatosis intestinalis, air in the wall of the intestine. What else are we going to see is that this is the second stage. Second B, portal vein gas. Portal vein gas. So the situation is deteriorating, and there is presence of air in the wall of intestine, and there is air in the portal vein as well, right? How will be doing the treatment part? So again same, NPO, right? IV fluids, IV antibiotics, but this time we will be pushing it more than 72 hours for 7 to 10 days, right? Now that we are keeping it for more than 48 hours and 72 hours to be precise, so we will have to start an alternate mode of feeding, that is TPN, total parenteral nutrition, right? So this is how we are going to treat a stage 2 of NEC, that is called definite NEC, right? Now let us talk about the third stage. Third stage, it is also called advanced stage of NEC. So this stage, see how we are going through the progression of the disease, right? So initially there was occult blood in the stool or fresh blood in the stool. It means that the intestinal walls were getting necrotized and were getting disrupted, right? In the next stage, what we saw is that there is presence of gas in the wall of the intestine. It means the process of necrosis is moving from the lumen towards the periphery. And in the third stage, what will happen is that there will be complete perforation of the wall of the intestine, and it will be a stage resembling that of shock. So our the picture that we will be getting in the investigatory part will be that of a shock, and also the clinical features will be very much similar to that of shock, right? So talking about the third stage or advanced stage, it is a stage of shock, right? There will be shock, there will be bleeding, right? Because there is complete perforation, right? And oh, come on, no, this one was that, right? There will be bleeding and there will be recurrent life threatening apnea, recurrent life threatening apnea, right? So now coming to the general features, we talked about it. And the abdomen, it is highly distended, highly distended. Abdomen is highly distended and tense, tender, right? And there is abdominal wall cellulitis, abdominal wall cellulitis. What will you see in the investigatory part? Again, we are going to do the abdominal x-ray. We are going to see the third stage of it, that is third A, peritonitis. Peritonitis, right? The peritonitis appears as a diffuse ground glass haziness appearance, right? And the third B, third B, because there is complete perforation of it, when we will be doing the x-ray, there will be, it is called gas under diaphragm, and it represents pneumoperitoneum, air in the peritoneum, right? Along with that, we will be doing further investigation and we will be finding severe acidosis, hyponatremia, refractory thrombocytopenia, refractory cytopenia. These are things we are going to see when we further investigate. So how we are going to treat this kind of a patient, because the patient is in shock, our treatment modality will be that of a shock treatment, right? So this is where, so in the treatment part we are going to do this, the initial part same as the second part, right? NPO, IV fluids, IV antibiotics, and TPN. Along with that, IV fluid bolus, right? IV inotropes like dopamine, right? Because the patient is going in shock. Blood products, right? Mechanical ventilation, because there is life-threatening apnea. Mechanical ventilation plus surgery, right? We will be moving for surgical procedures because there is abdominal perforation, right? So talking about prognosis, prognosis is 10 to 30% risk of mortality despite best supportive care. So this is all about the stages of NEC and its treatment. So this table itself will be enough to understand all the parts of NEC and how we are going to treat it.